Welcome back. Dr. Faisal Shuaib heads the National Primary Healthcare Development Agency. In this interview, Dr. Faisal talks about the role of primary healthcare centers can play in reducing the spread of the coronavirus, especially at the community level. Thank you for joining us on Dateline Abuja.
Thank you very much, Ibrahim, for having me.
Unfortunately, we are at the community transmission level for this pandemic, really a sad situation. At the community level, that's where you have the primary healthcare centers. So my question would be, how prepared are the primary healthcare centers to be the first responders?
Right, so several weeks ago, since we noticed from the outbreak in Lagos that there was evidence of a lack of epidemiologic linkages between the index case and some of the more recent cases, it became very evident that community transmission had started, and once community transmission started, that you no longer have the types of tight control on the outbreak like you would expect. So several weeks ago, at NPHCDA and the partnership, we developed a comprehensive manual on the preparedness and response to COVID-19 at the primary healthcare and community level. We disseminated this manual well ahead of this obvious community transmission that is now ongoing. That gave primary healthcare workers an insight as to what to do if they are faced with suspected cases of COVID-19. But beyond that, in the course of the last few weeks, we've also been able to share information to the primary healthcare workers. We've shared animation videos of what they should do if they were faced with cases of COVID-19. Clearly, the primary healthcare centers are not designed to manage COVID-19 cases, but a very fundamental requirement is that they should be able to identify, be able to have a high index of suspicion and know the next level of referral, right? What they should do if there's a suspected case. So that is what we've done principally in the last few weeks. But beyond that, we've also been able to develop training manuals. We've done training of facilitators at the national level. And we're at the point where we're stepping down this training of the next level, that is the state, the local government, and the community levels, so that all across the country, primary healthcare workers have all the information they need. They have the skills on how to make sure that they not only protect themselves from COVID-19 cases, but are able to triage and manage suspected cases and send them to the next level of care where they will be attended to. So pretty much we're on course in terms of building the capacity of primary healthcare workers, community-based workers, to be able to not only do their routine work, but also be able to impart the right messages to community members around COVID-19.
Good thing you've done the much you have done. If I go to a primary health center, for instance, and perchance there is this case of COVID-19, going by the trainings you have given your people, what are the exact roles that I expect to see from your health workers? What would I be seeing them doing?
So first and foremost, it's very important that the primary healthcare workers know that they are not supposed to manage cases at the primary healthcare centers, because that skill has not been impacted on them. There are specific isolation centers, treatment centers where all of that is supposed to be done. But if there's a suspected case, even before the suspected case comes to the primary healthcare center, we have already provided communication around how they should triage. That is to say, if you have numbers of patients coming, who are the folks that have the fever, they have the cough, they have the sore throats, they have difficulty in breathing, like those very, very key symptoms that we've observed with COVID-19 cases. So they now have started restructuring their primary healthcare centers to provide a space for such people where they will be isolated, while communication is made to the disease surveillance and notification officer of that local government area, as well as the state's epidemiologist and those contact numbers that have been provided state by state for primary healthcare workers, all health workers as it were, to make a call and say, here we have a suspected case of COVID-19. How can we get an ambulance to move these patients to the next level of care? So all of that complex operations are what we're impacting the primary healthcare worker with, so that even before that suspected case comes to the primary healthcare worker is aware of the protocols that they're supposed to follow to make sure that it becomes a situation where their health is not threatened, and the suspected case is also treated with respect, with compassion and dignity. That is very, very clear.
Exactly. That absolutely is my worry. You know, we know this primary health system, in spite of what has been done, there are still challenges. What happens to immediate treatment? I mean, he comes with pains. Some kind of treatment should be given to him, even if it's not for COVID-19. So what do they do when they take them to this special space that you have created for them? Are they going to be giving any sort of treatment at all before the ambulance comes, if it does come?
Well, what is very, very important to the primary healthcare worker is to secure these patients and make sure that they are calm, make sure that they are reassured that, you know, COVID-19 is not necessarily a death sentence, and even though they have these symptoms, even though they might suspect that they have COVID-19, you cannot be sure until there is a confirmatory test. So we do not know for sure that it is COVID-19, but because of these types of symptoms, we're going to keep you in this room and take care of some of the basic symptoms that you have. For example, you have body pains, they will give them analgesics, you know, but while making sure that, you know, they are comfortable, the primary healthcare worker has also been trained on how to protect themselves. So they will not manage, they will not manage, they will not engage with these suspected cases without the personal protective equipment. And when we're talking about the personal protective equipment, or PPEs, we're not talking about the hazmat suit, like the full complement with overalls and all, you know, like that makes them look like the spacemen. We're thinking more about the face mask, having the gloves, having the sanitizers, having the, you know, the provision of soap and water to make sure that they're able to wash their hands before they also engage with these patients, but at the same time ensure that not only do they have their face mask, but also such a suspected patient is provided with a face mask if he does not come with a face mask.
So those are the basic protection you require at that level.
Absolutely. We're at a situation where the primary healthcare system, like we've said in the last few years, have not had the kind of investment that they're supposed to have. So of course, even with the building of the capacity of primary healthcare workers to surmount COVID-19, we are aware that we still have challenges with the infrastructure of primary healthcare centers. We know that we do not have the complement of primary healthcare workers that we need in these primary healthcare centers.
In the next episode, we will conclude our conversation with Dr. Shoaib. In the meantime, remember that one of the ways the coronavirus spread is by touching contaminated surfaces. We also know that COVID-19 can live on surfaces for several hours, so ensure that you clean all surfaces with soap and water or disinfectants to protect yourself or your loved ones. Let's continue the conversations online through the email address and Twitter handles on your screen. I'd like to also encourage you to share anything happening within your locality with us. Don't forget you can view the program on youtube.com/channelsweb/videos. I'm Ibrahim Adra. Stay safe and see you next time.